the arm is tolerated for daily activities, those will be your exercises. If I tell you to do pendulum exercises, you're going to do this passively. So you bend the body over and you move the body to move your arm as opposed to moving your arm actively. Those are called pendulum exercises. If we ask you to raise the arm passively, what you'll be doing is, give me your other arm, you're going to reach behind your elbow and you're going to lift up this arm as tolerated, but not past the point of pain. And you're using the other arm to do this. Through passive external rotation, you grab a stick, a cane, or an umbrella with both arms. Keeping the elbows in, you're going to move this arm by moving the other arm. So you're going to actively use this arm to passively move this arm back and forth gently, like so. Do not push through pain. Shoulder impingement means that you are pinching the rotator cuff between the humeral bone and the acromion bone at the top. Most people will feel pain when they're reaching behind, or when they sleep on it, because when they lie on it, they're pressing on a painful spot. One of the things that I've taught you in the examination is about the Noy scapular tilt test. What that does, it does not diagnose impingement, but it helps us decide whether you may need or may not need surgery for impingement. The number one most common procedure arthroscopically in the United States is a subacromial decompression. Subacromial decompression means you're removing bone spurs and other impinging structures within the shoulder joint between the acromion bone and the rotator cuff. Most of the time, this isn't necessary. The way we figure this out is by doing the Noy scapular tilt test. So if you have pain reaching up, and at some point this hurts, from there to there, or sometimes you have a positive painful arc, so you have pain from here to there, or you may have pain all the way up. What we do is we have the patient bring their shoulder blades back, and then I will passively bring the arm up to the front and out to the side as the shoulder blades are back. If they have no pain, that's a positive test, and what that suggests is that therapy should get rid of the impingement rather than doing an operative procedure to remove the bone spur or other impinging structures, because we've rotated the bone backwards. So we have the patient bring the shoulders back, and then I passively will bring the arm up and out to the side during the motion that was painful. And if the pain goes away, it's a positive test. A positive test suggests you don't need surgery to fix this problem. So as you're coming up, you're impinging the rotator cuff against the bone. By bringing the scapula back, you may be missing that spot, which lets us know that we should be able to train the shoulder muscles to avoid the impingement without surgery. If you came up and you brought the shoulder blade back and you still came up and you're still having pain, odds are you're going to need the bone removed in that area. Therefore, since the patient is actively bringing their scapula back, we know that physical therapists can train the muscles to bring the bone away from the tender spot. Once this is done, the tender spot usually will stop being tender and then won't hurt. We will also talk about the no pain principle program of the shoulder, in addition to the scapular rotation exercises. And think about anything that sticks your chest out is bringing your scapula back. Reverse shoulder shrugs, rowing, similar things to those. You can do lat pull downs, but don't go above the shoulder plane. Stand up, grab the bar, come down here, and then do these exercises. When you're done, stand up and release the bar, as opposed to reaching all the way up, which causes impingement. The No Pain Principle program suggests that by strengthening the shoulder cuff, which is important not only for moving your arm in space, but pulling the ball down and into the socket. It will also decrease the space a few millimeters by pulling the ball down away from the impinging bone. Strengthening the cuff painlessly simply means if you're doing external rotation to get the back of the cuff, the infraspinatus and teres minor, and it hurts at this spot, stop before that spot and stay in a painless zone of motion. Eventually you'll be able to go further. If you're bringing the arm out to the side, thumb down, and it hurts at this spot, stop there. Internal rotation gets the front of the cuff. This gets the top of the cuff, and this gets the back of the cuff. So you do 3 sets of 10, 3 days a week, at least with a day off in between, but it has to be painless cuff strengthening through a painless zone of motion, combined with the scapular rotation exercises and icing the shoulder for 10 to 20 minutes once you're done. When you do the exercises, you're causing inflammation. It's going to get inflamed later that night, the next day. So you want to ice the shoulder when you're done exercising to prevent inflammation later on. This way you're able to work out again 2 days later, as opposed to it being very painful and now you're making it worse.